Hello, everyone. This is DJ D-Mac of D-Mac's Quality Smoke Room, located on stickem.com. I want to bring you another video tonight that has to do with medical cannabis. Now, I have a lot of people who are talking to me about it that don't really understand about it. And I can appreciate that. If you don't understand something, it's nice to get the facts about it. But just like if you were dealing with Republicans and Democrats, the Republicans like to feed you a bunch of BS without a lot of truth to it. They like to do a lot of smoke and mirrors uh, versus the Democrats who try and throw the facts out there for you. And then, so that's just like the Republicans right now are saying that the government should stop spending money. The government spending too much money. Well, just for all you Republican idiots out there that don't understand that Economics 101 says that in a time of recession, the government is supposed to spend money while the people save it. And in the time when there's no recession and we are doing good, the government saves money while the people spend it. Basic economics, people. You should have learned it in school. But we're getting off of that because we're here about medical marijuana and medical cannabis. Now, a lot of people, again, just have the misconception because back in the 1920s it was classified as a drug. You remember reefer madness and all that good stuff. Well, what the people did not realize was they were not taking marijuana off of the market, they were taking cannabis off of the market. And cannabis is a medicinal it has medicinal purposes to it. It can be used for medical use. And there are tons of reasons or tons of illnesses that it can be used for. And I'm going to go over some of them in a little while. And I'll let you know there's over 70 on this form that I'm going to read from. But what kills me is that there are people out there that would rather see people suffer than to smoke some cannabis to help them just because they got that impression in their mind that pot is bad. I would like to see the people have to deal with my back every single day. Let you wake up in the morning and feel like somebody has their fist just pushing in your lower back as hard as they can. Now, why don't you just walk around with that all day long? And matter of fact, why don't you go to sleep at night and have that same pain right there? Okay, and you go, well, yes, D-Mac, but, your doctor can prescribe pain pills for you and stuff like that. Well, yes, I do have Vicodin, Percocet, Flexeril, Scalactin, ibuprofen. Yes, I have all that. But did you by any chance know that every one of those that I just listed you can die from? Dave, are you sure, D-Mac? Yes, everyone. Did you know aspirin? You can die from aspirin from an overdose. Ibuprofen from an overdose. Flexeril, Scalactin, Percocet, Vicodin. All those you can die from an overdose. But how many people have died from an overdose of cannabis? I'm going to let you think for a second. But let me give you a hint. Yep, the big goose egg. It is basically impossible to overdose from cannabis. If you smoke too much cannabis, you're probably just going to go to sleep. And one of the other bad effects it has is you might not want to leave your lunch sitting too close to a person that's been smoking cannabis because they're liable to eat it. Because that happens to be one of the things that it is used for, is for the appetite. Anorexia, if you've heard of that. Bulimic, if you've heard of that. By any chance, if you know anybody who's got cancer and taking chemotherapy, anything like that. Well, personally, my thought is if my friends and my family do not understand or do not want to take the time to get educated about medical cannabis and the benefits that it has to you, I say, screw you. That's exactly what I say to you all. If you don't understand and if you don't want me to have comfort, I'm over 40 years old, and I think I know what is best for my body, and I think I'm responsible enough to do that. So it's just a shame when you see all the arrests that come from people, who have small amounts of cannabis, and all of a sudden their life is ruined. But yet you can let them go out and drink alcohol, take all kinds of pain pills and stuff like that, and smoke tobacco. But yet no medical cannabis, which has actually medical benefits to it, where none of the other ones seem to have alcohol. I don't know of any benefits for tobacco. I don't know of any other than like maybe a bee sting. So pain pills, again, they can all cause you to die, all that stuff. So let me quickly just tell you about a couple organizations that you should check out. One of them is called PUFM, PUFMM, which stands for People United for Medical Marijuana. You should actually take a peek at that, and it will give you all kinds of information and help inform you on it, which is what I'm trying to do, is to get people to go out and get informed on it. Okay, and now what I'm going to do is, I've tried to save a few minutes for this, what I'm going to do now is I'm going to try and quickly run through. There's about 70 illnesses that medical cannabis can help and has been used to treat. And I'm going to try and run through some of them real quick. And I cannot pronounce all of them, so try and bear with me. Okay. Acquired hypothyroidism, adrenal cortical cancer, agoraphobia, AIDS-related illness, alcohol abuse, alcoholism, Alzheimer's disease, amphetamine dependency, anorexia nervosa, anxiety disorder, arthritis, anthropy gout, autism. Let me get out of the A's. Bipolar disease, brain tumor malignant, bruxism, bulimia, cachexia, cancer, chemotherapy, chronic pain, cocaine dependency, Crohn's disease, delirium tremens, diabetes, adult onset, diabetes, insulin dependent, diabetic neuropathy, diabetic peripheral vascular disease, dysthemic disorder, endometrial cancer, epilepsy, fibromyalgia, I believe I pronounced that right, genital herpes, glaucoma, Graves' disease, hemophilia A, hepatitis C, AIDS, HIV and AIDS, hypoglycemia, impotency, Lyme disease, major depression, mania. Again, I'm quickly trying to scan it. Multiple sclerosis, nightmares, obesity, panic disorder, prostate cancer. So again, I'm just quickly trying to run through these because I'm running out of schizoaffective disorder, schizophrenia. So as you can see, senile dementia, herpes zoster, which is shingles, testicular cancer, tobacco dependency. So as you can see, this is not just your basic recreational drug. This is actually a medicinal medicine. So medical marijuana is used to help cure things, help people fight pain and other things. So I would just ask that you people get a little more educated about it and try to help support and legalize the right to medical cannabis. It is our right. Mother Earth grows it for us to be able to use. So please contact your congressman, state representative, or whoever and try and get medical